For this week, scenario week 13, we were dealing with an emergency at Cal Skate. We were at a skate party with with our son and one of his friends. Had skate was trying to show him a trick by skating backwards, and he fell down and hit his head, and he's not awake or not conscious. So, son tells me this. So first things first, we are dealing with a school age because they're 6 years old. So I think it's 7 or 8 is the school age. 12 to 13 is adult. School age. We're dealing with a school age pediatric patient. But first things first, before we go out onto the floor or anything like that, we make sure we grab our PPE. So in this situation, it will be gloves. I'm assuming nothing needed more, unless they're squirting blood out. But other than that, though, we just need our gloves. I would either I would let the father or the son know that I'm trained in in EMR. I'm going to train EMR, and I can help if that is their consent. If I have their consent, as I get their consent, I would ask the parent if they're okay with me being alone with their child for that split second. If they can run to the manager and tell the manager to clear off the floor as there's an unconscious patient on the floor. That will help me clear up the scene, help me get to my patient without dodging people or people dodging us while we're on the floor. It just makes the whole scene a lot safer. And then if I have skate shoes on, I would take them off just to make sure, I get out there calm, or I get out there safely without causing risk of injury to myself somehow. As I get onto the scene, I have my PPE, so my gloves on. He's a school age patient, so we're gonna be treating them a little differently on how we take care of them. They're unconscious, or the LOC, level of consciousness, is no level of consciousness. Then we check the ABCs: airway, breathing, and circulation. Check the airway, make sure it's clear. We check his breathing by keeping our hand right above his chest or right on top of the chest, and then putting our ear close to their mouth and nose to feel and hear the air of them breathing. And circulation, we will either just pinch their fingernail to see if it turns back to pink within a couple seconds to show us that his blood is circulating. But if our patient was not breathing, then we would immediately go into CPR. This is a school age child, so I believe we just go into 1.5 inch deep on our compression. And we would do 30 compressions for 2 ventilations on this patient until either the patient wakes up, we see signs of life, we keep going, or another trained medical responder comes onto the scene. But that's if our patient is not breathing or not showing any signs. So let's just say now our patient is okay, squared away, they're just still unconscious. Before we move them, we do know that they had a head injury, so we just do a primary assessment, just make sure there's no blood, no other injuries that we have not seen, without moving the person's body or neck per se. So what we do, we don't know if it's a head or neck injury or if there is one. So we would just check the neck to feel anything out of place, check the head for any injuries. Patient is still unresponsive. So so unresponsive, so we would either move them out on a stretcher or a splint board, and just to make sure that because they're still unresponsive, so we do not clearly know if they have a head or neck injury that we cannot see visibly. So we would move them out, keep them sustained. But if they did respond, they did come back to consciousness, we will let Jose know in a very calm, not monotone, because kids don't like to hear that. Very calm and maybe encouraging tone of saying, "Hey, Jose, you were skating with our friend, and you just fell backwards and tripped. My name is Andre. If he doesn't know me, my name is Andre. I'm here to help you. I'm trained in EMR. So I'm just gonna let you know I conducted already a couple of tests on you. You seem to be doing fine. You're breathing. You have circulation. Your airway isn't blocked, so you're doing pretty well. Do you mind if I continue my assessment to make sure that we're fully good to go? Um, and hopefully, the kid might be a little nervous, so I'll be letting them know what I'm doing as I'm doing it. I will start from instead of start from head to toe. I'll start from toe to head, just so that the patient feels comfortable, is easy and relaxed, and they're able to see what I'm doing up until the point where they can't really see it, so they are able to be comfortable with me. After we complete our assessment, we will kind of just verify that Jose's okay. We'll ask how his neck or head feels. Since he did hit his head, we could do concussion protocol, which is I'll grab my light, see how his pupils dilate when when the light is shown into their eye. I will ask him his name, last name, day of the week, and maybe if he knew why we were at the party, whose birthday was it. Signs that if he does have concussion will be, staggering of memory for all those subjects. They might feel dizzy or nauseous, so they're signs of concussions. If they are in a concussion protocol, we would just have them relax for a couple days, take it easy. I believe what I did was I had to drink a lot of water and eat some vegetables. I don't know why, but that's what they told me. But yeah, so to make a quick run of it, Jose's injury, we do our PPE. We clear the scene by having all the skaters move off the floor. I calmly but efficiently move on the floor with my shoes. I checked the LOC of Jose. I checked ABCs, see how they're doing with their breathing. If they weren't breathing, we do CPR, 1.5 inches, 30 compressions for every 2 ventilations, or 2 ventilations for every 30 compressions. And then if he did respond, we would let him know what happened, do a toe to head, talk in a nice upbeat tone so they can understand how, or not be frightened of the situation and furthermore than they are. Just let the parent know that Jose might have a concussion, concussion protocol. If they do, all the tests, staggering memory, eyes wouldn't dilate, all that stuff. If they don't, we'll let them know. He doesn't, should probably take it easy, relax for the rest of the day. And then the primary assessment, from toe to head, we would check up any injuries. I don't think we need to do a sample history. We could, but other than that, it just seemed like a very minor incident of kids just skating and hitting their heads. We could do like sample history of what they've taken, what they eaten, if they're on any medication, if it needs to go that intense. But yeah, I think that is it. Thank you.